A bit about the current situation, and that is, of course, coronavirus or COVID-19, and what its effect is on a pregnant woman. So, we've seen a lot of pregnant women, and as a faculty at a large public institution in Bombay, and also we see these quite commonly now in private practice. So, in the situation of COVID-19, a pregnant woman, first of all, can get affected at any point in time. It could even start or even happen when she's trying to conceive, when she is just become pregnant, in her second trimester, and also towards the end of the pregnancy. Now, if you are a patient or a woman who has experienced fever or cough or any other symptom, such as conjunctivitis or even a sore throat, maybe weakness, fatigue, one must inform the physician or the gynecologist as soon as possible. When one does inform the gynecologist will work with a physician who will look after these symptoms. As a woman, when some of our patients, when they contact us and tell us that they are experiencing fever or any of these symptoms, first of all, we reassure them. Every fever doesn't have to be COVID-19, but it has to be tested and ruled out. Of course, pregnant women are not immune to the complications of COVID-19. So one has to take care and be vigilant right from the start. When one gets fever as a pregnant woman, we usually advise them stay at home and get tested for the COVID-19 virus. One usually gets two types of tests. One is an antigen test, which is done by a nasal swab, and the other is an antibody test, which can be done by a blood sample. These tests, unfortunately, have a false negative subset. What I mean by when I say false negative means that there will be a group of patients who actually have COVID-19, but this test does not detect COVID-19. It might be due to a wrong sample, or it could be an inadequate sample, or it could be due to the fact that the virus isn't present at that sample site at that point in time. Nonetheless, in a majority of cases, these might come positive. So until the test comes positive or negative in that interim phase, we advise the woman just to stay at home, relax, don't get stressed out. Sometimes the stress itself can cause complications of a pregnancy. And just to be well hydrated, have vitamins, have vitamin D, you have zinc, vitamin C. So these are common supplements to just keep healthy. Now, apart from this, of course, if a woman in her pregnancy starts feeling breathless or has certain complications of COVID-19, one must get admitted into a hospital, preferably which has support of an ICU and a ventilator.